Can she hear us? Am I waiting for her to appear? Oh, okay. All right. Hi, everybody. Welcome. As you know, you are at the Fragility Forum 2024, saying this for the purposes of our recording that we are making and our live broadcast. Welcome to what I hope to be a very engaging discussion today on building human capital in fragile settings. And first of all, I'm Danny Clark. I'm part of the communications team for human development here at the bank. And I'd like to welcome all of you, especially those who are coming from outside the World Bank and have been participating in this forum over the last few days. So we're here with our panel to discuss the why, the how, and the what of protecting and building human capital in fragile systems, education, health, social protection, especially in places where there is violence, conflict, and fragility. And I think, I'll say this to my panelists, I think we're here to have a discussion, first of all. So we'll be discussing first with our panelists and then with you all. So as we're going along, please think of questions that you want to ask. We have an online audience also, so we'll be taking questions from the online audience when we get to that part. And but I think we're here to make the case really for protecting people's most critical assets, their health, their education, their well-being, and somehow in these fragile situations, seeking to build it at the same time. And that's the difficult part. And so we're also here to discuss together across the humanitarian, development, and other sectors, how we can support each other on the path ultimately to peace. So let me introduce our panel. First of all, we're very thrilled to have on the line Dr. Hodan Osman Abdi. She is a rock star. Okay, I won't go through her whole bio, but I will say that you speak Chinese, English, Arabic, and Somali fluently. I read that in your bio, so I just want to that's amazing. She is the Senior Advisor and National Coordinator of Human Capital Development at the Office of the Prime Minister of Somalia. And next to me here, we have Sarah Taylor, who's the Director of Conflict, Stabilization, and Mediation for FCDO, and I will spell that out because we're trying to be more acronym sensitive here at the bank. Foreign, Commonwealth, and Development Office for the UK government. I'm sure all of you know that. And Jordi Renard, Director of Strategic Partnerships for the World Food Program. And our own here at the World Bank, Michal Rutowski. He is the Director for Human Development for the Eastern European and Central Asia region at the World Bank. So again, I want to remind you that my job here is to make this as engaging and dynamic as possible. So we're going to try to be brief with our responses so that we can leave time. We can leave time for questions, but also I'll be trying as the moderator to make some connections between what I'm hearing and picking up themes that we can pick up as we go along. All right. So I'm going to start with you, Dr. Abdi. Thank you again for joining us today. I know you wanted to be here in person, and so we're just thank you also for being online with us. And thank you for your passionate commitment, by the way, to education, because I know that education and women's empowerment are some things that are very important to you. Could you talk to us about the experience in Somalia? We all know this is a country that is literally constructing its state from the very ground up right now and has already made important progress along that road. How does human capital fit into your vision and your national plans?
Well, thanks a lot, Jordi. And I'd like to thank the organizers of the Fragility Forum, and especially this sub panel that we are participating in today. It's true, I really did want to join in person, but our next best thing is thanks to Zoom. I'm really honored to be amongst you today, especially alongside Sarah, Michael, and Jordi, and also yourself, Danny. I understand that all of you have extensive experience and work in this field. Coming to your question, I think Somalia's case is extremely interesting, especially in the context within which the Fragility Forum and this specific panel is being discussed today. Somalia has had its fair share of conflict and misfortune, but after this prolonged period of instability, we're finally seeing glimpses of light and glimpses of hope. And we're seeing a lot of progress happening in a lot of areas. Most significantly can be highlighted in the most recent achievements of reaching the HIPC completion point, or lifting the arms embargo, or also even joining the East African community, all of which indicates that the state is reaching a stage of maturity. Now, when it comes to human capital development, like you said, personally, I am passionate about especially education and human capital development, because my personal experience has taught me that these are the two most important ways to liberate a community from a perpetual state of need and poverty into a state of self-reliance and resilience. And these are the critical factors that drive fragility, conflict, and violence. If we address those through empowering human capital development, then we are 10 steps closer to reaching stages of stability and development. Now, in the context of Somalia, of course, Somalia is at a very, very critical stage right now in terms of planning what our next strategic moves are. We've reached the HIPC completion point, but what does that mean? That means we have access to investments. We need to guide these investments in a strategic manner that can enable us to reach a demographic dividend, or reach the ultimate goal of having a population that is not only healthy and productive, but is also contributing to the overall growth and development of the country. I would like to highlight only 3 of these plans that we're right now working on. Our long-term vision, which is the Centennial Vision, Vision 2060, also prioritizes human capital development and makes it a critical pillar within it. But that being a more long-term strategic plan that hopes to achieve a middle-income country by 2060, we also have strategic development plans, which are now going to be turned into national transformation plans. The transition from a national development plan to a national transformation plan was a very strategic decision made by the Prime Minister to prioritize strategic investments and strategic initiatives that drive innovation and drive transformation from the ground up in order for us to achieve results in very important ways. And to guide all of that process, we're also working on a comprehensive human capital development strategy that not only takes into account the challenges that Somalia is going through, but also, most importantly, takes into account the opportunities that are abound within the country. Somalia is rich with resources. Our problem right now is that we don't have the human capital to actually capitalize on these resources and create the wealth and richness that would enrich the people and hence enhance the economy. So we're hoping that through these phased approaches and through these comprehensive and synchronized plans and strategies, we would be able to better guide the process. Thank you.
Thank you. Thank you. Congratulations too. Let's zoom in on the how. I'm going to turn to Sarah and ask about resources and about financing from your perspective. We know that resources are scarce, and like Dr. Abdi was saying, choices have to be made and there has to be prioritization. But from what you've seen, can you talk about the competing demands and the challenges from your perspective?
Thank you. Thanks very much. And it's such a pleasure to be here. I'm really hoping to learn a lot from our discussion. I wanted to focus some of my reflections at a really early stage of this process when we're looking at countries in crisis or pockets of crisis and shock within countries, and how we are making some of those spending decisions to support human capital, both its protection and its growth. And for us, that's really takes us to sort of, I'm going to be the first person in this meeting to say it, to the nexus, right? To how do we make sure that when we are delivering humanitarian aid, making choices about spending humanitarian aid, that we are understanding the importance of using those interventions to protect human capital. And so we all know the figures, right? In 2022, half of bilateral aid for the top 10 DAC countries went on humanitarian assistance. That tells me that we need to be getting more out of that humanitarian assistance than just working on a problem. We need to be treating that problem through that assistance, because that's where our money is going. And so making sure that we are using that humanitarian assistance to protect the human capital in countries that have already made investments but then suffer a shock, and also to support lay the foundations for growing it further is fundamental. And that means that we need to do that even as we are delivering life-saving assistance. And we need to do that where there is a state, we need to do that in concert with the state, reflecting the priorities of the state, making sure that we're working with partners to align with those priorities so that the social protection that we're providing enables those populations under stress to access broader human capital programs. And that's really where we try to focus that work. And we also need to make sure, as we're going in with that life-saving support and we are building that social protection in from the start, that we're thinking about transition from the start. We need, if we're using humanitarian aid to support social protection, we need to be thinking about how are we getting out. And again, we need to do that in partnership with the state. So those social protection regimes that we're putting in place, we really need to be building from the start with the government to help understand how are they going to take those, how that ownership for the state needs to be built in from the start. If there isn't a state that we can work with, then how are we making sure that we are building packages and programs that a state can take over? And that means listening to the citizens, listening to the recipients. What do they need from those social protection programs? How are they wanting them to support their human capital as they transition out of crisis?
Thank you. Jordi, World Food Program plays a very critical role in obviously humanitarian crises and responses, but from your perspective, how do you approach what Sarah was talking about, protecting the human capital while also providing the life-saving support? How can you do both? How does World Food Program approach it?
Thank you. And I might start by also thanking the organizers for the opportunity to participate in this event as WFP and also to share the panel with the distinguished panelists. I would like to start by emphasizing the need for humility in this agenda. In the different sessions I've been able to participate, there's been an emphasis on the lack of national capacity, lack of capacity to absorb resources, to mobilize climate financing, to be better prepared to respond to shocks. And I think we would need to qualify that for two things. One, because I think change is difficult, is very slow, and is messy. And then because our own capacity as international organizations is very limited in terms of affecting rapid transformative change. So for WFP, I think our approach to capacity development has not emerged by design. It has been emerging as a demand from partners to really make available the knowledge, the experience we have in implementing our own operations. And as Sarah was mentioning, also to thinking about how we can do that better from the start. In terms of human capital, I think, for example, we've seen a shift in how we've been operating. For example, in terms of food assistance and nutrition, we've been engaging more and more with governments to, for example, around food fortification. So instead of bringing our own imports of food, to work with national entities, with the private sector to ensure that food is available as fortified as we could bring it from outside. In terms of school feeding, instead of implementing our own programs, we've been shifting that implementation with handover strategies to governments to ensure that they have homegrown school feeding strategies, making those linkages with markets, with food systems, and on social protection, and taking advantage that we have Hodan in the panel as well. We've been working very closely with governments, like the government in Somalia, with the World Bank, to make sure that from the start we leverage our experience as humanitarians to make available our knowledge of the nuts and bolts of what we are trying to do. And I think in Somalia, we've seen that around the social registry, around payments, around inclusion, financial inclusion of women's grievance and redressal mechanism. And these are the kind of things that if we embed early on our programs, this is part of our discussions with partners, we can really make a difference.
Thank you. I'll turn to you, Michal, to tell us about the World Bank. We are here at the World Bank to tell us how the World Bank has been helping to specifically maintain some services in a difficult situation, particularly Ukraine. And it's such an incredibly volatile environment.
Thank you very much, and congratulations to the organizers. Given that one of the themes is clearly a diversity of FCV settings, let me say a few words about how on one hand similar and how on the other hand different Ukraine is as a FCV place. It is similar because there are active war zones, there is active combat going on, there are millions of displaced people, and throughout Ukraine, in any place, you can be attacked by drones, by missiles, or by bombs from the planes, and don't know the place. It's a mixture of targeted and untargeted bombing. That makes it similar to many FCV settings. What is different is, and it is very, very important, that Ukraine has a fully functioning government, that Ukraine is highly digitalized, that Ukraine has a system of social protection that reaches many people, and that this government, at the very same time when they do rehabilitation and reaction to the war, they also are committed to various reforms, including reforms in the health sector, in social protection, and in education. Therefore, when it comes to us, our main support to Ukraine was through budget support, supporting salaries to be paid on time to civil servants, to teachers, to first responders. Our main operations, there are several, but I would mention the peace operation, which disbursed $29 billion till today. Inspire, social protection operation, $1.2 billion. We are able to disburse those big sums of money because of the helps of the donors, especially in the form of guarantees that allows us to overcome the single borrower limit. The challenges in Ukraine, many of them are typical FCV challenges: housing for refugees, rehabilitation of facilities, serious mental health issues. Some of them, however, are very special to Ukraine. One example is the fact that every school needs to have a school shelter, and this shelter needs to be equipped so that there could be continuous education even during bombing. And in that context, that is a very important context. Maybe a bit specific, although there is a lot of refugees across countries in Africa as well and elsewhere and in South Asia, but we also have a huge spillover effect. More than 1 billion Ukrainians are in Poland. And then there are big waves to Romania and Moldova, and we do have operations in Romania and Moldova trying to help the IDPs. Let me maybe finish by focusing a bit on education in Ukraine. It is very important because you have a situation where almost 15% of infrastructure has been destroyed because of the war and because of the bombings, because we still have a situation 1 million kids cannot attend schools because either they cannot get to school or the school doesn't have a shelter and doesn't operate. And then the learning losses are tremendous, and they are equal to 2 years of learning. 38 PISA points. That's what we see in terms of learning losses. So our education involvement is an interesting aspect of a mix of access and quality. Access is fundamental, but the main losses are quality losses. So we need both. That's why the main priorities are essentially rebuilding schools and access, but also remediation, catch-up, mental health for children, and continuation of reforms. Ukraine has a great reform program called New Ukrainian School, big reforms of curricula, of teachers training, and we are associated with that with technical assistance. We are preparing a LEARN operation, 220 million P4R, which is going to be a mix of rebuilding rehabilitation, and we need to finance school shelters as well, which is very specific to Ukraine, but also big support to the reforming curricula, teachers training into a modern education system. So what is fascinating in Ukraine, and when I saw it being in Kiev a few months ago, what is fascinating there is that even under bombings, those people in the government think of a mixture of rehabilitation and reforms. In a way, there is even a pressure on reforms to move faster, to use the opportunity of what's happening around, meaning that essentially everything is in flux, to actually advance reforms faster than sometimes countries do that are not in the FCV setting.
Michal, can I dig a little deeper and ask you to reflect on why education in a situation like this is an area to prioritize? And then also, Dr. Abdi, I saw you nod, and maybe you want to come into that.
The reason I talked about education was not that we prioritize over health and social protection, but because the human capital losses are the most visible there and the most damaging and can be calculated using results outcomes. When we started indeed with salaries. I talked about it, but our first big project was a HIL project in health, when we were both rebuilding facilities, but also continuing the reform of health financing in Ukraine. Then we moved with Inspire, which is social protection project, and other than support for higher education and other than support through the peace operation to teachers, this is only now when we are coming with a designated education operation. But we are doing it because losses of human capital are huge, and because the government prioritizes it. And it is really, really remarkable that the Minister of Education is a reformer, and Minister of Finance has trust in the Ministry of Education that they will not only focus on rehabilitation and shelters, but also on the reform program. And there is this dynamic partnership, I would label it like that, between finance and education, which from human development perspective is fascinating, because we work also in countries when there are huge education needs, but Ministry of Finance doesn't prioritize. It's not concerned at all. They think in terms of, controlling financial flows, teacher salaries, nothing more. In Ukraine, there are a few forces together which makes it moving so fast.
Let me pick up on that vein of prioritization and turn back to you, Dr. Abdi, and ask how do you prioritize, and what have you prioritized in Somalia, and why? As far as investments go, thinking of the long term, while also, I'm sure, dealing with a lot of shorter term crisis situations.
Well, thank you very much. I think that's very important to highlight. But before I get into that, I just wanted to follow up on Michal's point on the importance of education. It's true, the human capital losses are the most visible there. But I'd like to quote a Chinese saying that says, 授人以鱼不如授人以渔, which means teaching person, please don't point, but teaching a person how to fish is a lot better than giving them fish. What that means is you have to empower a person to have the capacity to actually earn a dignified living for themselves. And there's no better way than education or technical, whether it's, normal, the tertiary education or technical and vocational education. And this is why within the human capital development agenda, education is the cornerstone of any progress that we'd like to see in that area. Now, when it comes to our current work in Somalia, especially at the stage we are in right now, we are at the most critical stage of setting the foundations. And we are fully cognizant of the fact that if we set the foundations right, then we've set up the country for success for the near future. And these foundations, especially like you've mentioned, in a country like Somalia that has suffered, for a long time of state collapse and lots of conflict and fragility, the foundations that need to be set are diverse, but we've kind of prioritized it. So in terms of, as a framework for creating and implementing a human capital development strategy, we start by setting the strategic targets. We focus on delivering the services, but within delivering the services, we focus on institutionalizing service delivery, which actually goes with what Sarah was saying earlier about making sure that whatever initiatives we're doing, whether in social protection or anything else, is something that the government can actually take over and continue. So institutionalizing service delivery, especially by increasing government spending in human capital development, is also a clear priority. But at the same time, placing human capital development at the center of the national policy discussions is also one of the most strategic priorities that could be focused on. But systemically speaking, though, and if this example can be taken also by other similar nations, I would say that we start by first setting the foundations. You set the right foundations by building the systems, instituting the legal frameworks to make sure that you are standing on a correct and solid footing, building the capacities, whether they are the human capacities to deliver or the systemic capacities to ensure the sustainability and longevity of this delivery. And also, what's equally important is maintaining awareness. Maintaining awareness of the importance of continuing work on human capital development so that with the class priorities, it doesn't slip through the cracks. By maintaining this kind of prioritized approach and setting the foundations right, we're hoping that not only the work will continue, but it would hopefully lead to more sustainable results.
Thank you. And I would just add that human beings make up systems. And so it is a virtuous cycle, or can be. Sarah, could you share some reflections on the connection between these types of investments and prioritization and human capital and peace building?
Thank you. I'll give it a go. And I also just wanted, again, sort of building on what Dr. Abdi said about both institutionalizing these services, but also maintaining the work, keeping that work going, which I think sort of speaks to a broader agenda that's been a theme for the last few days about how we stay engaged when a system that is on the right track, is doing all the right things, but suffers a shock, be that a conflict shock or a climate shock. I wanted to just sort of highlight some work because it also helps support a point that I've also heard throughout this event so far around partnerships, work that the World Bank is doing with the government of Somalia, with donors as well, to really test how we can use social protection to lay foundations for systems of support, this transitioning point, this institutionalization, but also thinking about how we can support shock responsive systems of social protection that mean that where we are supporting the protection of human capital, we're not seeing that go backwards when we experience the arrival of conflict, for example. And that is a really important part of our approach, making sure again that the dreaded nexus, that our humanitarian response is supporting our peace response because it is supporting the social contract between the state and its citizens by making sure that the essential services, that institutionalization doesn't break when it suffers a shock. So I hesitate to use a Somali example with Dr. Abdi on the line. She'll know so much more about it than I do. But the Bax Nano program that we're really proud to be supporting and working with the Somali government with the World Food Programme, with the World Bank, a really excellent example of partnership where we are working together to institutionalize social protection, to build shock responsiveness, to really get that connection between humanitarian aid leading through into development opportunities, but at the same time building peace resilience into the system by building and supporting that social contract.
Go ahead.
Thank you very much. What Sarah said motivated two reactions on my side. First, I'm actually very happy you talk about Somalia, because in my previous job as Global Director for Social Protection and Jobs, I was watching these adaptive safety nets developments, and we were supporting it and working very hard with you and others on that. I wanted to highlight the mutual learning from FCV context. For instance, the fact that in Ukraine we pay salaries and reimburse when there is a proof that they were paid, it actually uses examples from other places, including Somalia. So in a way, inspiration for the way to do it in Ukraine came from other FCP settings, and this is important. The second thing, it also refers to what you said earlier, Sarah, is the need to coordinate humanitarian assistance with government systems and make sure that humanitarian assistance actually supports more long-term institutional reforms. This is a big challenge. In Ukraine, I can see that some of the programs which were badly needed added to the complexity and multiplicity of programs in social protection in Ukraine, and they are very difficult to finish. So in a way, the system further deteriorated by being balkanized rather than being more consolidated and integrated. And I think it's a big challenge for us, donors, to sit together with some regularity in order to find those strategies which allow to move transit from the humanitarian assistance being in use to institutional building and strengthening the permanent institutions.
And Jordi, you spoke of humility earlier. How, to Mihal's point, how do we avoid, as development actors and donors, overburdening these countries and systems in place?
I would say that
and others can add their thoughts to this, because I wonder if it's something that's on your minds as well.
No, I think you started the moderation, but by putting an emphasis on the how, no, that you wanted to see the panel address the how, and I think that's in a way critical, no, because we all have our strategies, our programs, our own operations, but then what's the venue, the platform to really put that together in common, no? And what's the kind of joint planning that we can do to move forward those strategies. To me, that's one of my passions, I would say, and that's why I like to be in this field of work and in this partnership role. But I think it's extremely challenging. I think instances like the Fragility Forum actually help put together this community of practice and a change to learn from the different contexts, as Michal was mentioning. But I think we are at a moment where we have a critical mass of knowledge, a critical mass of change makers within each of the institutions, and a critical mass of willingness to move the needle at the system level. No? I think either the 21 replenishment provides a great opportunity. We've seen a lot of emphasis on partnerships in the World Bank, that we've been growing with time with Michal and his colleagues in social protection, but also with other parts, with some of our donors as well. But either 21 provides that opportunity. And I think if we could shift the needle a little bit around co-designing and providing those opportunities to design early on, that's going to be transformational.
But Dr. Abdi, how does it feel from your end? How are we coordinating as a development community well enough? And tell us how we could do better. And what are your reflections on that?
Thank you very much. I think this is an important point. I've been appointed as a national coordinator for human capital development quite recently. And one of the biggest challenges that I found, other than the work of the government itself being mostly in silos, that even the development partners' work is also done in silos. You would see institutions such as, within the UN family, the WFP would be implementing important work when it comes to social protection, when it comes to school feeding programs. Those programs are not completely in sync or synchronized with the work that other UN agencies, such as, let's say, UNICEF is doing. It takes a very simple exercise of coming to the same table and trying to maximize the impact of our resources, since the resources are already being very, very limited. if we get together and we pool our resources together and we pool our efforts together, we are able to find that the biggest impact can be reached in specific and certain areas, which could have a domino effect and a multiplier effect on other parts and aspects of human capital development. How can this be done better? I think by ensuring that the government is at the center of all of our efforts. If we place the government in places or instances where the government is there, and we ensure that they are at the front and center of every decision that we're making and every effort that we're taking, and they are taking the responsibility a lot more, at the front stage than the development partners and the implementing agencies, then we would definitely see a lot more results in terms of synchronizing and coordinating work a lot better. But that also goes to the point that Jordi was making of making sure that we're also at the same time building the capacity of these institutions to be able to implement the work and sustain the implementation of this work. And it takes effort, it takes time, but it also takes a very deliberate decision for us to prioritize sustainability and long-term effects over short-term emergency responses.
Can you speak a little bit more to that balance between the short-term and the long-term and your own personal engagement within the government to ensure that these longer-term investments are being made versus the response to shorter-term crises?
Well,
and then we'll go to audience questions right after this. But go ahead.
Yeah, sure. Thank you very much. So in the case of Somalia, well, as you know, our fiscal space for spending, especially in social services, is extremely limited. But at the same time, we do get a fairly large humanitarian spending budget every year. This humanitarian budget is utilized in saving lives. But in a way, it puts us at a perpetual state of need. So every year we need to do the humanitarian assessment and humanitarian call for fundraising. Whereas it's true, some of these short-term interventions for life-saving efforts are extremely important, but equally, I 100% believe that, for example, to address the drought, utilizing strategies such as digging wells makes a lot more sense than water trucking. Water trucking would provide life-saving water, yes, for this population for today and tomorrow. But what happens when that funding is cut? These people are still in the stage of need. So within, the humanitarian spending, I think it's extremely important for us to think about spending humanitarian funds more towards sustainable efforts and sustainable initiatives.
Thank you. All right, let's get to questions. We have some questions. I think you all can stand up, and are we passing the mic around? Is that what's happening? Yeah. We'll pass the mic around. Anyone wants to ask a question, and if we get questions from online, we'll have Caroline read them out. So.
Hi, thanks so much. Clinton, I'm from World Vision Syria Response. So what we've heard a lot in this forum has been talks of a formal government. Obviously in Syria, we have 4 contested geographical areas of control. Sarah, you spoke about social protection needing to be built. And then when a government comes in, you can kind of hand that over. So I'm just curious from panelists, have you seen an example of where this works? What does that actually look like? Because we don't have a formal government in northern Syria, northwest Syria, north central Syria, the northeast. These are contested areas of control. And how do you do social protection? And Dr. Abdi, thank you so much for your example of water trucking. This is something we struggle with in Syria also, where right now we don't get any humanitarian funding to do anything beyond water trucking, and that funding is going away. And so regularly now we're faced with camps that are not getting water because we haven't been able to implement sustainable solutions because there is no development donor who's willing to give funding to do anything sustainable. So we're in massive trouble in Syria, and it's really encouraging to hear what is happening in Somalia. But just curious in terms of social protection, what do we do? Even WFP right now in Syria is struggling for food assistance. In northwest Syria, 1 million people in the last year have lost food assistance, and it's a problem. So really just curious how we can connect this to exactly what's going on in Syria right now.
Who on the panel wants to respond? Oh, go ahead. You can go ahead, Dr. Abdi.
Thanks very much. I'll leave the rest of the answer to the panel, but I really just wanted to respond to the social protection part and how you can make it sustainable while you're delivering a service at the moment in anticipation of a day when the government can be there. Well, for those of you who know how social protection initiatives started in Somalia, we were heavily supported, and I think we still are being supported by outside agencies such as WFP and UNICEF. But from the get-go, from the design was to transfer these services and make them institutionalized. And for that, one key component that was developed was the Unified Social Registry. Having a unified social registry and developing such a system enables us to register and ensure that the most vulnerable members of the society are within the system. This enables us to deploy resources as soon as a shock or a crisis happens, or in terms of the long-term support of those underprivileged people. And this is an example of something that could also be utilized in Syria. In the absence of government, perhaps these implementing agencies could create a unified social registry instead of having 200,000 people with World Vision and another 100,000 people with WFP maybe, and then having conflicting and clashing numbers, that would amount to conflict in the later. Having a conversation within the implementing agencies and donor community within the region, create a unified social registry, utilize that, and when the government comes, transfer the system to the government so that they are able to utilize it. Thank you.
Yeah, maybe on the Syria, I think the Syria case, there's the issue of funding to start with, and then the relationship with the government. But I think as we implement operations, we are very conscious that the systems we develop for our own operations then eventually can be shared with partners or handed over to the government. In terms of other contexts, and I could make, if I can, a pitch for an event that it's actually taking place tomorrow during the Partners Day. It's at 8 o'clock in the morning, so I'm sure you still all have energy for that. There's gonna be a focus on the partnership with the bank and the World Bank and UNICEF in the Sahel. And the work there is basically, they call kind of track 1, track 2. Track 1 is when conditions allow, when funding is available, transfers are channeled through public through government systems. Track 2, areas of the country that are not accessible, then UNICEF or WFP take care of those vulnerable populations. I think that can be extended elsewhere. I think Hodan was referring to these. These are good examples, and if you want to know more, tomorrow 8 o'clock.
It's more based on my previous job as a social protection global director, but I must say, with WFP, I feel we have one of the closest partnerships also UNICEF is in the same space. And Jordi pointed out, it is absolute, and Dr. Abdi, it's absolutely critical that government systems are used whenever possible and that they are not substituted, or there is no rerouting. And of course, dynamic social registry is fundamental. Regarding WFP, big progress, I think, for several years in WFP is that you are paying most of your assistance in cash, not in kind. This is a sine qua non condition, because if you do it in kind, then it is a totally different world, very difficult to transfer. And then if we together will be working from the beginning with the government system, from the get-go, getting them involved rather than using our own delivery, it is a bit in our DNA to do it. We always want to work with the government systems. That's why I see, and my colleagues see it as a tragedy what is in Afghanistan now, because in Afghanistan we cannot work with the government, so we need to essentially operate delivery systems through other development partners, and that doesn't translate itself well in mainstreaming afterwards.
All right, let's hear some more from the audience. There was a question back, the woman back there. Yes. Stand up. Yeah. So he can see where to bring the mic. Yeah, and then you. Let's take the two questions and two questions. Yeah.
Thanks, Ruth Quinn from the Global Survivors Fund. Dr. Abdi spoke about foundations for moving forward, and I feel that reparation is a key one for many of the people emerging from conflict-affected areas, but it's not something that we're hearing about being financed directly. And I'm wondering if the panel could speak to that, about financing for reparation as a lens through which we can build the foundation for human capital. Thank you.
And the second question.
Hi, thank you. Dr. Abdi, you spoke around having humanitarian investments also contributes more towards these kind of national system building capacities. I think that's an important point, and I'd like to maybe hear some of your thoughts on that, but also for Mr. Rukowski, from the social protection perspective and from the World Bank perspective, have you seen this happening in Ukraine, for example, where there was a very strong humanitarian presence? And do you see ways in which the World Bank can, when it's doing these kind of system building approaches, invite those type of investments or facilitate those?
So I'll perhaps just pick up the point on reparations, if I may. And it's great to see the fund here, and we're so delighted to support it through our Preventing Sexual Violence in Conflict initiative in the UK, and many other supporters around the world for the fund as well. So I think reparations are a really important way that we invest in human capital, and really important way that the governments can invest in human capital, because they're really essential to helping traumatized populations, women traumatized and men traumatized by sexual violence in conflict, overcome that trauma, find new ways to reintegrate into society, find new opportunities to protect their livelihoods, to access education. And so thinking about reparations as one key of how we're investing in human capital, we're helping populations and the most vulnerable people, the people who are most vulnerable in conflict, as we know, women and children, begin to rebuild their lives and be on that journey to recovery after conflict. And so I think we absolutely should be thinking about reparations in that sort of human capital space.
And the second question on how the World Bank perhaps can support.
Yes, so if I may, on reparations, in the case of Ukraine, there is no payer of reparations. However, there is very active discussion on seizing Russian assets overseas and do, so to speak, forced reparations. But it's underway, it's not clear where it will go. Very interesting question, humanitarian versus social protection in Ukraine. I think with many donors, we have very good understanding. We need to work with the government systems. When there is a bit of a problem is if they are single issue donors focusing on something, for instance, early childhood development, and then they work, they get financing for additional programs to help children. The programs are very much needed, but totally disconnected from what the government does. And in a way, we see our role, as we were always with the government, as bringing them together so that we can chart a transition path from these additional resources, which, by the way, will dry up because it's temporary, to permanent programs, which creates enormous tension in Ukraine because those additional resources created expectations. They are not sustainable, and the government has increasingly difficult fiscal situations, and is also not able to take them over. So the financing, so increasing the number of programs during the war, and then inability to continue and inability to transfer them creates a very, very difficult spot for government with respect to relations with the population, and we haven't found a solution yet.
Okay, we have one online question, Caroline.
Yes, please. A question from Tana Makoka to Dr. Abdi. What are the most urgent needs currently in terms of health system strengthening in Somalia? Thank you.
Well, thank you very much. Before going to that question, I just wanted to have a very brief comment on humanitarian assistance and how can we make that more sustainable. I think it's a conversation that we need to be having it at a higher level and also in a more deliberate way. Donors now, we've all noticed that they are a lot more cognizant of the value for each penny that's being spent. The appetite, or not just appetite, but the conflicting global demands and the rising humanitarian needs and the increasing of shocks, especially with the increase of the effects of climate change, are also challenging the space of humanitarian assistance. So it only makes sense that we try and squeeze out every value possible out of each dollar that is spent on humanitarian assistance. And the smart way to do that is to spend it on sustainable initiatives and spending more on sustainability and not on one-term work. So I'll leave that at that. When it comes to health systems in Somalia, well, the health sector in Somalia is extremely privatized at the moment, which means that the average Somali cannot simply afford to even get the healthcare that they need. Adding to that, the fact that the quality of the services that are being provided are really not at par with what is needed by the community. And this is definitely understandable given the long history of state collapse in Somalia that has given space for a lot of private entities to operate. And it is taking a lot of efforts from the government, not only to regularize the sector, but to also ensure that it is able to respond to the rising needs of our population. I'm sure you're very much aware of the demographic status of Somalia. We have a quite a high fertility rate of 6.1. 74% of our population is under 30. And our population is expected to increase by over 23% by 2030 alone. And we're expected to double by the year 2050. That means that it puts a huge stress, especially on our most basic services, the health sector, the education sector, in terms of delivering services and ensuring that our population is healthy. What I would recommend, or what we see as the most important areas of investment is one, the human capacities. It's a simple fact that we need more doctors, we need more nurses, we need more qualified doctors, we need more qualified nurses, and at the same time we also need more qualified midwives and other supportive personnel to support this. Furthermore, we also need the basic infrastructure. There are vast areas in the country where not even an NCH is available. And people, when a mother is giving birth, she has to be carried or she has to be driven miles and miles to the nearest center where she'd be able to find healthcare facilities in order to deliver in a safe place. So we both need the soft interventions and investments, but we also need investments in the hard infrastructure to enable us to instigate these systems. One thing that I would really love to highlight is an opportunity that we have with emergent technologies. Technology integration, especially within the healthcare system, is an amazing opportunity for us to expand healthcare throughout the country at low cost, especially given that Somalia is a unique case in developing countries in terms of internet penetration. We are considered one of the highest countries when it comes to the internet penetration rates, especially in rural areas. So there is an opportunity to use smart solutions to allow access to quality healthcare, even to the remote areas. But we just need to channel investments toward that.
Great, thank you. We'll take one more question from the audience and then I'll have the panel wrap up. Is there one more question? Okay, back in the back there.
Hi, I'm Elliot from UNICEF. So my question is from a comment earlier on about the importance of really strengthening the partnerships at the organization level. I think it was mentioned that UNICEF and WFP could do more in that realm and really bring the government at the center to create that sense of responsibility for the long term. And so my question is, how do you concretely create that sense of responsibility? What is it about stronger partnership and what type of priorities can we put in place to really create that idea from the government that they are responsible and that they can't rely purely on the international level and they have to take responsibility?
Thank you for that question. And if you can be as concrete as possible, are there joint strategies, regular meetings? How does this happen in the actual day-to-day? Maybe Jordi, you want to take, and perhaps Sarah. Actually, everyone could speak to this.
So I wanted to say from my experience for the partnerships to work, and UNICEF and WFP already mentioned, we see it's a very close partners to the World Bank in social protection area. A few things are needed. First, actually, top management attention is needed. That is actually very important. Meetings at the highest levels. But then what I observed is that implementation in the countries differs heavily for two different reasons. One is typically when the government is not in charge or is weak and cannot coordinate, it is not going well. If the government is stronger, wants to coordinate, is put in the first place, it goes well. And the second factor is more related to people. In some places at the country level, our representatives are very open to cooperation. In some places, they are less open to cooperation. So it's very important also within the institutions to give effective signals that we would like us to work together among us with the government in a driving seat. And it did happen successfully in a few places, but also it wasn't successful in many others. But I want to end on the positive note and say, I think we are doing much better after World Humanitarian Summit in 2017 in Istanbul, when a very strong signal was given that humanitarian development space is one space, not two different spaces, and it needs to be filled from everybody. Thank you.
Go ahead. Sarah and then Jordi.
Thank you. I'll sort of try and approach it from two different angles. On the partnership, so one of the models that sort of fall into my space, in the conflict space, when we're looking at prevention and resilience, is the importance of creating, as part of our planning and our programming, and particularly when we're working in partnerships, political dialogue. And that, as Mikhail says, needs to happen at the highest levels, but it really does need to be about the political dialogue between the government, the World Bank, if they're in place, donors, and NGOs, other actors, because essentially you need to create a shared plan for how we're going to do this. And that means we need to, the questioner sort of talked about the responsibility of the government, but it's also the responsibility of us to listen to the government. How does the work and the programming and the support that we want to put in place respond to the future that the government envisages for its people? And this really needs to be a shared opportunity, but we do need to think about, when we're going in for programming, how are we building that political dialogue, that senior high-level dialogue, into our processes. It's not just about a technical program delivery. It needs to go right from sort of the top of the government conversation through to the bottom. And the other part of it is, it's not just on the government, right, to drive the partnership. Mikhail mentioned, some of us, and in some places we're better at it than others, but we need to think about what are the incentives in other institutions to drive partnership. And so if we're in the World Bank, we look at the World Bank. I would suggest that the World Bank's incentives for its staff and for its management are not geared towards working in FCV contexts as well as they could be, because a focus on disbursements, while absolutely sort of fundamental to the World Bank, doesn't necessarily take into account the context of some SVC places. We need to really be incentivizing staff to want to work in these contexts, to see them as part of their essential career progression, to design bonus systems and incentive systems that are based on quality and impact, as well as on getting money out the door, as important as that is. And so thinking about how our own institutions and the supporting institutions to governments are incentivizing that partnerships, I think are as important to get the right staff in the right places with the right skills to build those partnerships.
Go ahead, Jordi.
So as always, the last one answering the same question and gets the tricky part of not repeating anything. So I'm going to try to evolve what Mihail and Sarah had mentioned to give a concrete example, and it's related to the incentives. I think we don't share enough resources. Everybody, each institution puts forward their plans, their programs, their staff, their secondments to the same ministry, for example. So one way of creating that kind of conversion and coherence would be to actually work together to develop the TORs of that single person that is going to move forward the needle on behalf of the different institutions. We have some experience of this with the World Bank in the field of social protection in Mauritania, for example, that we co-share the consultant to work with the government. And I think these are the kind of things that we need to mainstream more and more.
Okay, thank you for those concrete examples. I forgot to mention at the beginning that please do share about this event and other events that you are participating here at the Fragility Forum, hashtag Fragility Forum. So thank you for doing that. And I want to close us out by making a statement and then asking all of you to respond to it, let's say. And the statement is, investing in human development, human capital, if you will, is investing in peace and stability. Dr. Abdi, go ahead.
I couldn't agree more. It is the reality. It is the future. It is the only viable solution. Investing in human capital development is investing in peace and stability, because what better way than to get people to want to live in peace than to actually have a stake in the matter? And when they are living when they are living in dignity, when they are living in the midst of development, when they are receiving all the services that they need, then they have a stake at maintaining that peace and stability to continue this.
Okay. Sarah, any reflections?
Thank you. I think Dr. Abdi said it, so I'll perhaps just make a slightly broader point, if I may, because I couldn't agree more. That we know that in 2030, 2/3 of the world's poor are going to be living in FCV states, and we're still talking about FCV as though it was a sector strategy. This is now going to be the core business of the World Bank. Investing in these states, investing in the human capital of people living in fragile conflict and violent states. We need to stop talking about it as though it was a sectoral strategy, and we need to start thinking about how do we adjust to make this core business. And so we need to be looking ahead to IDA 21. How are we using IDA 21 to make that change possible? How are we building those incentives that I mentioned earlier to get the best people into these states who really understand how to operate in a conflict sensitive way, in a climate sensitive way, to deliver those? And how do we make the argument that yes, partnership comes at a cost, right? Collaboration has a transaction cost. We know that. But that's a transaction cost worth paying, because it fundamentally saves money, because fundamentally it will make us more efficient if we can pool our resources, if we can pool our skills, if we can work with governments, with NGOs, with banks, with donors. We will save money, and we will be able to make those transitions between humanitarian, development, peace, climate more quickly and more efficiently. And so let's accept that transaction cost and work through it, because it is going to save us money and it's going to support the human capital of these people who are living in these states. Thank you.
Thank you. Over to you, Jordi.
No, from my side, just kind of to emphasize the agility that we need to maintain at the institutional level, no, and the capacity to both be on the front lines, but also to take the perspective to see whether what we were planning to do when we planned it is still relevant, or we have to adjust that. I think we've seen, kind of an array of crises proliferating. We've seen it even this morning, with the headlines in chat. I think we need to really find ways of thinking together how we are tackling some of these emerging crises.
Okay. I didn't mean to do this to give the last word to the World Bank person at the World Bank, but go ahead, Michal.
So the sentence was investing in human capital is
investing in peace.
Is investing in peace and security, and I would simply add to that, and future growth and employment. Thank you.
Yes, okay. Thank you, everybody, for joining us today. Thank you to our panel, and especially Dr. Abdi for connecting. Thank you.